Hello, I'm Jong Eun Lee from Hassan Medical Center. It is an honor for my colleagues and me to have our research featured in the American Journal of Radiology. I would like to express my gratitude to all my colleagues and mentors. On behalf of our research team, I am pleased to introduce our study. The title of our research is Lung Cancer Staging Using ChatGPT and FDG PET free text reports, comparison among 3 ChatGPT large language models and 6 human readers of varying experience. Before starting the presentation, I would like to disclose that there are no conflicts of interest. Here is the background of this study. Although radiology reports are commonly used for lung cancer staging, these tasks can be challenging given radiologists' variable reporting styles, as well as reports potentially ambiguous and/or incomplete staging-related information. Large language models could have utility in helping to extract lung cancer staging information from radiology reports. Such a role for large language models could have varying benefits depending on the skill level of the medical professional who would otherwise perform the staging assessment. So the purpose of this study is to compare the performance of ChatGPT large language models and human readers of varying experience in lung cancer staging using ChatGPT and FDG PET free text reports. Here is the bold diagram of this study. The radiology databases of the 4 institutions were searched for reports matching the keywords lung cancer or lung malignancy for ChatGPT or FDG PET examinations performed in adult patients from January 2020 to December 2023. Among the identified reports, some of these reports were excluded for the following reasons. First, reports for follow-up after lung cancer treatment. Second, reports did not contain appropriate descriptions for lung cancer staging, such as sizes and anatomy of patients of relevant abnormalities. Thirdly, reports for evaluation of small cell lung cancer. Of 1,100 eligible free text reports, 700 reports from 700 separate patients were randomly selected for the final analysis to compare TNM lung cancer staging by large language models and human readers. To determine the reference standard for lung cancer staging in free text radiology reports, 2 board-certified thoracic radiologists reviewed the reports in consensus, focusing on 6 key elements and the TNM categories. 3 large language models, including GPT 3.5, GPT-4, GPT-4, were accessed via their respective APIs using scripts written in Python. Radiologic reports were extracted in Excel file format, and 2 prompts, including parameter extraction and TNM staging classification, were prepared in Word file format. A script-based API approach was used for analysis. All these processes were based on our web application to automate the entire workflow, and then extract results and time were recorded. Here is an example of large language model lung cancer staging test. The extracted free text radiology report is interpreted by large language models with prompts, ultimately producing results in the form of answers for 6 parameters relevant to lung cancer staging and the TNM staging. For comparison with large language models, 6 human readers at 3 different experience levels were included. 2 fellows grade radiologists, 2 fellows, and 2 radiology residents. This table 1 summarizes the characteristics of the 700 patients and radiology reports. The reports were generated by a total of 10 different radiologists across the 4 institutions. A total of 78% of reports were written exclusively in English, 21% in a mixture of English and Korean. A total of 71% of the reports were for chest CT examinations, 28% were for CT examinations. Based on the reference standard, the distribution of overstage groups were as follows. Able to summarize the performance of the large language models in extracting parameters relevant to lung cancer staging. GPT-4o had an accuracy of 99% for greatest dimension of the primary tumor, 87% for local invasion, 81% for satellite lesions, 96% for metastatic lymph node, 84% for intrathoracic metastasis, and 96% for extrathoracic metastasis. In comparison with GPT-4o, accuracy was significantly lower for the greatest dimension of the primary tumor for GPT-3.5 and for extrathoracic metastasis for GPT-3.5 and GPT-4. Table 3 summarizes performance of large language models and human readers for determining overstaging groups. GPT-4o had an accuracy of 74%, which was significantly better than the accuracy of GPT-4, GPT-3.5, and Resident 2, significantly worse than the accuracy of fellowship-trained radiologist 1, fellowship-trained radiologist 2, and not significantly different from the accuracy of fellow 1, fellow 2, and resident 1. This figure 2 shows the variations across large language models and human readers in overstaging accuracy and mean test completion time per report. Values above bars present overstaging accuracy for each evaluator, and asterisks indicate evaluators with significant difference in accuracy in comparison with GPT-4o. Dashed line represents overstaging accuracy of GPT-4o. Green line and its associated values indicate mean task completion time in seconds per report for each evaluator. So this is the final slide presenting the conclusion. The best performing model, GPT-4o, shows no significant difference in staging accuracy versus fellows, but showed significantly worse performance versus fellowship-trained radiologists. These findings do not support use of large language models or lung cancer staging in place of expert healthcare professionals. Thank you for your attention. I would also like to express my gratitude once again to all the contributing authors of this paper, the human readers, and the assistants. Thank you.